Dr. David Bull's Sunday Surgery.
Well, we thought we'd do something different. We were kicking ideas around, weren't we, Doctor? And we started thinking about complementary therapies, and you and I were both talking about acupuncture, and then this term of dry needling came in, and I'm amazed that Phil's still in that control room. I thought he'd be on the floor by now. So I'm going to introduce our next guest now, which is Suk Pada, founder of a bio... is that right? Bodysync. I see. Very good morning to you.
Thank you, David. Nice to be here.
Really nice to meet you too. So can you... We talk about using complementary therapies a lot now, and I think, I don't know about your own medical training, but certainly it wasn't anything that we really were trained in at all.
I had one session, I remember, because it was fascinating, on homeopathy. That was it.
I didn't even have that. I mean, I do remember talking about acupuncture for the use of chronic pain, for example, particularly people who'd got bony pain from metastatic cancer. So let's start at the beginning, shall we? Tell us about you and what you do.
So I run Bodysync, so this is a holistic clinic, and we use a variety of modalities to treat physical pain, digestive issues, emotional issues, and acupuncture is one of the main modalities that we use, as well as our own sort of body realignment. We use craniosacral therapy, visceral massage as well.
Right. And acupuncture, just talk us through, because it's centuries old, isn't it?
It is. It originates in China. It's over 5,000 years old. And it works, and the sort of the fundamental premise about acupuncture, it works that the healthy functioning of the body is governed by the flow of chi, or life force of the energy of the body. And this flows through various channels within the body just under the skin, which are known as the meridian channels. So there's 12 of them in the body, and majority of them are associated to an organ. So you have the stomach channel, liver channel, and they run all over the body. And so if there is any disruption in the free flow of that, then it will cause illness in the body. And disruption could be caused by physical trauma, emotional distress, poor diet, digestive issues, etc.
Okay, and just in terms of that, these are needles that you put in, sterilised needles.
Yes.
I have to, and if you are of a nervous disposition, do look away now. These are sterilised needles that you put there, as you say, along these chi lines, and you leave them in the body for how long?
Normally about 20-30 minutes.
Right.
And what it is the insertion of these fine needles just under the skin, because these meridian channels, they have certain points on them. There's about hundreds of points across all over the body. And the way I really describe it to people is, imagine you've got an electricity board, you've got a bulb at one end, bulb at the other. One is really bright, the other one's slightly flickering, and you've got the flow of electricity. You have switches to control that flow. So you turn the switches to get equal distribution of electricity, so both bulbs are illuminating at the same intensity. And so these acupuncture points are basically those control switches. So either turn the volume up or down.
So, Doctor...
So
yes,
we talked about this. Do you remember when we did our piece on chronic rhinosinusitis? And I'd actually seen somebody in an acupuncture session that I was in say, oh, my nose is constantly blocked. And the acupuncturist put some needles into their shins.
Yes.
And instantly, their nose started to pour.
Yeah.
I watched it with my own eyes. So that's how this first came up. Is that something that you treat often?
Yes, we do. And we use also... There's lots of different facets of acupuncture within there. We also use a technique called distal mirror imaging acupuncture. For example, if you came to me and said, oh, my left elbow is hurting, I would use your right knee, because the more distal you are, the greater the impact. And the arm and the leg are mirror images of each other. So your knee is your elbow is your knee.
So given the way we're taught in conventional medicine, how do you square how this works with the way that we're taught?
Good question. So it's you do still get a lot of people who don't really understand it, because the fundamental point is understanding chi, or energy, and people go, well, what is that? Does that really exist? So it also promotes the flow of blood, free flow of blood. It's also pain repressant as well within the body, and this is sort of main functions of how dried needling sort of works as well.
There've been some good studies, I think, with IVF, that women that have IVF, have acupuncture before their IVF, get a better placental build-up and lining of the uterus.
How do you reconcile that? How?
I can't reconcile any of acupuncture, but I'm happy to accept that in circumstances it works.
So also, if you think about it, is removing blockages. So fertility issues, it could be blood stagnation, for example. So it's increasing that free flow of blood, that free flow of energy. And we use it a lot in conjunction with sort of techniques such as IVF as well.
And so you mentioned also there dry needling. So you've talked about acupuncture. What's dry needling?
So dry needling is really a Western perspective of acupuncture, and is really about myofascial release. So myo means muscle, fascia is the connective tissue which surrounds the muscle. So if you have really tight muscles, there's tender, there's trigger points within that. So basically it's the insertion of the needles to basically release that muscle, release the pain around it. So it just sort of relaxes the muscle, and it works on the sensory nerves
So
as
lots
well.
of physiotherapists use acupuncture
Yes.
now as part of their treatment.
Yeah.
Yes, and so, but that is almost, you say it's a Western side, so I understand that the energy levels which you use, the distal, the further side, but the dry needling is using much more anatomical references.
It is, and it's localized needling.
Yes.
So it's at where the pain
Which
is.
I understand much more, given our conventional training.
And also it's really used for musculoskeletal type of issues. So you would, a physiotherapist that wouldn't use it for digestive issues or emotional issues. They use it for physical pain or there's restriction in movement.
Is acupuncture available on the NHS?
Yes.
It is. It is.
It is,
I
because
don't
I
know
was
how to
reading
refer
about it,
somebody.
but
It is,
only
yeah.
for certain things.
Only for certain things, yeah. But a lot more physiotherapists, chiropractors, osteopaths are using it now as well.
Right, dare I say, shall we have a go?
We're going to dig needles in you. I've been waiting for this moment.
So I don't know. I don't think I ever agreed or consented to this. Well, I did actually, but that's not
Because I do it to your dolly. Does that help?
Yeah, I know you do on a daily basis. Right. So, just talk us through what you're doing.
So safety first. Just putting on.
I am slightly nervous.
Putting on my
Don't be
gloves there.
nervous.
And also, depending on the acupuncture that we do have various needles, various lengths of needles as well.
Can you use the longest for him?
No, do not use the longest. You are horrible.
Ones in here. I mean, these are the standard ones we use here, and these are like 2.5 mil in length. We use very small intradermal needles.
Stop grinning.
This is for facial acupuncture, so very small.
Let's pass on that.
These are for finger acupuncture. There's finger points as well. And this is a lot, you would have seen a lot of celebrities that have it, auricular acupuncture for addictions and things like that as well.
Right.
So this is in the ears. So it's the premise that, you can map the body, map areas of the body anywhere on the body as
Do you
well.
have any pain?
I do. I have chronic back pain, actually, thoracic pain.
Right.
So upper back pain, but that's because I had an injury many, many years ago. Thank you, doctor, for asking.
Well, I'm just trying to,
Yeah. Right. I'm slightly nervous about this. What would you like to do?
So
David's you've got your hand ready.
Yes. So at the moment, yes, for people on
yeah,
radio.
so
of course,
really just for demonstration.
just for demonstration
really.
purposes. I'm
You're
just seeing
gonna-
if that's
I'm
in there.
just gonna
Can you see that? So where I kind of need to hold it up, really.
Well, why don't you let him put the needles in, then lift it up and show the
Okay.
needles?
Well, I might not survive.
So I'm just going to just swab it.
Right. Hang
Look
on.
away now, anyone watching on TV who doesn't
Let
like
me see if I can
needles.
just get that into shot a bit. Okay.
Okay.
Oh, hang on. Right. Sorry. Right. Go.
So just really, that's one.
Well, actually, I can't feel anything.
Exactly.
What do you mean exactly? You're not the one having needles
But I've
stuck
had
in you.
acupuncture.
Oh, I see.
And there's different techniques we can
Right,
use.
I'm holding it up
if the
now.
point is really tender. we
Okay,
can
so
turn the
sorry,
needle-
they can't hear you at the moment. So you're saying that.
Yeah. So we've got the needles in here.
Right.
So there's different techniques we can use. If the point is really tender, we can just slightly turn the needle anti-clockwise, so you're sedating the point, so you're calming the point. If you want to tonify the point, so it's sluggish movement, we'll slightly turn it clockwise. So that's almost
I
like
felt that.
turning the volume up and down
Right.
technique.
Is it
And we
hot
can
in
also
here?
apply. We can also apply heat to the needle just to stimulate it, infrared
Oh, can we apply some
light
heat
as
to
well.
No, we can't apply some heat. Also, why is Phil, the producer, lying on the floor?
I know, I'll have to go and resuscitate him in a minute.
Okay, so you can see those needles there. It's really fascinating. Okay, thank you.
But it's not exquisitely painful,
No, it is when I move it.
so it's just touching a nerve.
Yes.
Yeah.
And then, to be honest, they go in between 1 to 3 mil.
Yeah.
Right.
So it's just really from the surface of the skin.
Okay, do feel free to remove them.
Yeah.
Well, only because I thought I did quite well. I mean, it is extraordinary. Thank you very much indeed. It didn't actually hurt.
Yeah. There will be certain points which could be a little bit sensitive depending on what the patient comes in with. And sometimes you get a sensation of a tingling sensation, sometimes heat. Some acupuncturists also apply very, very low currents to the needles, just to
So
stimulate the
physios
needle
often
further.
do that.
Yeah.
And do women use this, for example, not just to sort out their uterus for IVF, but for relaxation?
Yes. The biggest thing is, the main things we see in clinic where people come from acupuncture is pain, inflammation, anxiety, sort of stress, digestive issues, and to help with fertility.
So with my back pain, which is high up in the thoracic vertebrae, and that is a disc issue. It was a subluxation. So basically the spine, the thoracic spine, got
the vertebrae moved.
The vertebrae moved because of a traumatic accident, basically. Is that something I could use?
Yes,
acupuncture?
definitely. So it would definitely help with the pain, with the relaxation of the muscles, and removing any blockages flowing in there. But then we would also combine it with our body treatments as well, because when you do the combination of treatments, that's when it becomes very powerful.
And where would you put the needles for that?
We would probably use down here the bladder channel, so that bladder channel runs along the back. We could also mirror the back along the arm, and we put the needles here. And even we normally put them down here for the back, because if you look, this is the hip, so there's a mirror image of the hip, so that reflects that. So we wouldn't actually put them directly in the back.
So it is interesting. So as you know, Callum is a Formula One mechanic. He's very tall. He's 6'5", and he's always bending. So he gets thoracic back pain.
Does he?
So they travel with a doctor on the circuit, and he swears by the acupuncture.
So, well, it's really interesting, because at the moment I have to hyperextend, i.e. I have to find a sort of lumpy thing and then hyperextend over it and crack my back to get rid of the pain.
Yeah, but also what we do, we teach our patients as well. Obviously, you know, we don't say stick needles in you, but you can use techniques such as acupressure. You can use infrared light along those same channels.
And acupressure, you press on them.
You press, yeah. To get the treatment is really effective if you put the needle in, but next best thing, self-treatment, is acupressure.
I have a question for you. Do you do laser acupuncture? This is Miss Edie Weeds.
Laser acupuncture, in terms of, we use a laser on children, because obviously with children and infants we wouldn't stick a needle in, so we use laser acupuncture where we go along the channels.
And I've just been asked here, good morning, doctor, says Sarah in Berkshire, would acupuncture help fibromyalgia?
Yes, it does.
And where do you put the needles for that?
Well, fibromyalgia, it depends on where that pain is. And we also use lots of different diagnostic techniques. So we look at the tongue. The tongue is a reflection of what's going on in the body. It's divided into series of
I think there's
organs.
a lot in that.
There's a lot. So it's not just putting a needle in there. There's a lot of patient history and all of that put together. But if you were to look at a picture of dry needling and acupuncture, think, oh, okay, there's a needle in the skin at the same point. But how you get to that point is vastly different.
Can acupuncture cure tinnitus?
Yes, we use tinnitus. And in a lot of cases with tinnitus, we find it's an emotional distress.
How interesting. So that's interesting. Sean in Bicester says, I have fizzing in the top of my neck. Could that be managed by acupuncture?
Yeah. With acupuncture, almost anything.
Yes, so we have a donkey. From birth, she couldn't stand up. The vet went through all of the traditional treatments. As a last resort, jokingly tried acupuncture. She's now 5 years old, has acupuncture 4 times a year, and has never had a problem since.
Yeah, and a lot of vets are doing acupuncture with horses, dogs, cats. Yes.
How do you reconcile this? Because we are taught in a completely different way.
So shall I tell you how I reconcile it?
Yeah.
I've seen it work. So for me, if it works, it's like homeopathy. I have no idea if it's just placebo, but even if it's placebo and it works, that's
I think it is
fine.
placebo.
But yes, I think probably too. But acupuncture, I don't think it does. I think it works. I think we have a lot to learn from the Chinese in their medicines and their acupuncture. This comes from China. I've seen it work. I'm happy.
And you know, you mentioned about running noses and chronic rhinosinusitis. David, this one says, 25 years ago, I had one session of laser light to prevent the acute sinusitis infections I used to get. It stimulated my body to get rid of the old scar tissue my sinuses I used to get. It stimulated my body to get rid of the old scar tissue. My sinuses started working again properly. I have never had a sinus infection since.
And it all comes down to stimulation of these energy points of the meridian. So you can do it with needles, with light, with heat, with acupressure.
We must remember that the NHS and the Western medicine model is based on drugs.
Yes, it is.
So things like acupuncture or homeopathy don't get the attention they should, because nobody's going to profit from them working.
It's true. And also with dry needling and Western medicine, is symptom-based medicine. This is, we go for root cause. So what's causing the issue is not just the symptoms.
And two more, if I may. Is it good for osteoarthritis?
Yes.
In the knee?
Yes.
And where would you put those needles?
Probably in the elbow, because there's a mirror image of the knee.
Does it help with parathesis?
Parathesis.
So
yes.
something that's been paralysed.
Yes, yeah.
Okay. Does it help with eustachian tube syndrome? Debbie Close is asking.
Oh, eustachian. Yeah.
Definitely.
Oh, I need that right now.
There you
I've got
go.
a very blocked eustachian tube, let me tell you.
And again, we'll combine that with our cranial therapy as
Yeah.
well. To
Right.
really get the
And
therapy.
is it? Oh, this is a good one. What about stroke victims?
Yeah, I mean, we do help with stroke victims with acupuncture. Now, it's not that they are going to get
Is that
full
to
mobility.
release ligaments and
Yes,
things?
releasing as well, and reducing pain and stiffness in the joints as much.
So for people, I mean, it's
because
absolutely.
we use scalp acupuncture as well. So in the head.
Really? I mean, it's absolutely fascinating. For people who do want more information, how do they find out about you?
Yeah, so Body Sync is the clinic. We're on all the social media, and I think you'll probably have the details up. But yeah, email, call, on social media.
How are we spelling Body Sync?
BODISYNC.
That's why I got it wrong at the beginning. It was very complicated. Body Sync. Thank you so much for coming
My
in.
pleasure.
Really
Thank you for
interesting.
inviting me.
Pada there, founder of Body Sync. Fascinating
We've
discussion.
opened up. The lines are going now.
I can see that. And that was, of course, today's Sunday Surgery.
Dr. David Bull's Sunday Surgery.